This short video is on the rehabilitation of shoulder impingement syndrome. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then we suggest you skip the short theory section and go straight to the rehabilitation exercises. The exercises are grouped into the stretching or mobilizing type and strengthening type. Can you tell us what is this syndrome?
So syndrome, as the name suggests, is a kind of myriad of several things. The impingement aspect tends to imply that there's something getting trapped or pinched in the subacromial space. So
what is the subacromial space so that we can actually show it?
So we have something called the acromion process, which is just a projection of the shoulder blade or scapula, which forms almost like a little bit of a bony roof over the ball part of the upper arm. So we have a ball and socket joint. Underneath that roof, or that acromion process, we have several structures passing through. We have a bursa, or like a little fluid-filled sac, which helps reduce friction from some of the sliding structures underneath. We have the rotator cuff tendons. We have parts of the joint capsule. We have the acromiocoracoid ligament, as well as a host of other things.
Very complex, isn't it?
It is quite a complex area. It's an extremely mobile joint, a lot of stuff going on, and a lot of mobility, but sometimes slightly reduced stability.
So what sort of events, what sort of problems can lead to the development of this condition?
Again, there's going to be numerous biomechanical factors at play. So sometimes if we have slightly reduced thoracic extension, it's going to compromise how our shoulder blades can move when we try reaching up overhead. So if we think about someone who's spent a long time either driving as a career or working at a desk as a career, which is a lot of us, we might find that we have these kind of slightly protracted, rounded forward shoulders. When we then go to reach up overhead, we are somewhat restricted. So that could be causing a little bit of irritation. Additionally, if we have certain occupations that do require us to do a lot of overhead work in the first place, such as
like you're cleaning windows or doing
window cleaning, plastering, painting, lots of stuff like that. It's sustaining that arm flexed up overhead, under load, under resistance, and it's just kind of restricting that space.
Let's say they've come to see you about getting this diagnosed, and then you've done some treatment. Would you prescribe any exercises they can do in the interim to assist in the rehabilitation process?
Absolutely. So what we want to do for happy, healthy shoulders is make sure that we can improve the movement of our shoulder blade around our rib cage. Make sure we have good mobility in our thoracic spine, so we're not in that kind of flex position.
So you're not just focusing on the shoulder itself, you're actually dealing with...
Often the stuff occurring in the sort of shoulder, in the case of a sort of an impingement type syndrome, is a consequence of other factors. Again, if we have any kind of tightness in our pectoral muscles, it's going to be affecting how the arm forward, it's going to pull you forward. We need to remember that the a lot of the muscles on the back, pectoral muscles at the front, are coming and attaching into the humerus or the upper arm bone. So good biomechanics there is very important, and also good strength of the rotator cuff.
So obviously impingement is impinging, is compressing. What are you trying to achieve?
We're trying to improve function. So the kind of misconception that's existed for a while is that we have either a loss of space or that we're somehow going to create more space. But what we're really trying to do is improve function, because what we tend to have is when we have irritated structures, they tend to swell, they tend to take up the space that's there.
Like the bursa you mentioned.
Exactly,
earlier.
Bursa, thickening of the tendinous sheath. Again, other factors, as you mentioned, arthritis, we can have arthritic changes that might occur at our acromioclavicular joint, where our collarbone and our shoulder blade will meet. And if that's kind of not really addressed, over time you can actually get slight bony change, which could have these little bony spurs or projections and project down into that space, irritating some of the tissues. The rotator cuff, namely the supraspinatus tendon, which passes under that space, can become a little bit calcified and just cause a bit more friction.
And I believe that's one of the most commonly ruptured tendon, isn't it?
Partial tears in the supraspinatus tendon are extremely common and in many cases can be symptomatic. However, they can be quite effectively rehabbed and become asymptomatic or settle down.
Go ahead and show us some exercises, please.
So, see, the first thing we want to do is just get the joint nice and mobile and loose. So to do that, we're going to do a simple pendulum type movement. We'll pick an appropriate weight for our participant. So in this case, I think this 2 kilo dumbbell will be fine. What I'm going to have you do is support yourself on one knee and have that arm just hanging down. I want you to feel the weight almost just feeling like it's pulling your arm out of its socket, not as horrific as it sounds. And then I just want you to let your arm swing around gently in a circle. And I want it to feel like it's very fluid, almost like your arm is just like a pendulum, kind of freely swinging back and forth a bit. Spend around 30 to 45 seconds doing this. It's going to encourage a bit of traction force through that joint, creating a slight gapping effect. I'm going to progress on to stretching the pectoral muscles. As we mentioned earlier, if we have very tight pectorals that are pulling our shoulder forwards, that's just going to be what we call a maintaining factor or provocative factor to this condition. So to do this, I'm just going to have you do a simple pec stretch. So if you come against the wall and you're just going to take a split stance. So you might find it whichever way is comfortable for you, one leg forwards, one leg backs, and just twist yourself away from your point of contact. You should feel a stretch through here. Do you feel it there? Yeah. So do that other side. Good. So in this position, when you feel a nice stretch there, just sink into it, focus on some nice deep breaths. Next thing we want to do is encourage good scapulothoracic movement. So that is the movement of the shoulder blade around the rib cage. For 180 degrees of overhead range, we need about 60 degrees of that to be coming from our shoulder blades. So what I'd like you to do is just something called a wall angel. I want you to have your hips, back and head in contact with the wall. And I want you to just try and reach your arms back against the wall, trying to establish good external rotation here. If you don't have this range, that's not a problem. Just try getting as close to that range as you can. And again, not pushing through any high degree of pain. If you feel mild discomfort, again, that's fine. It shouldn't be getting worse as you do this movement. What I'm going to have you do is just reach your arms straight up overhead. Good. So in this instance, Matthew's arms came away slightly from the wall. That's not inherently wrong. That could be to do with tension in the latissimus muscles, which we'll talk about stretching later.
But you're aiming to compress the arms against the wall as much as possible.
We're aiming to sort of maintain some degree of contact with our arms against the wall. It doesn't have to be every inch of our arm. The reason for that, again, is we want good thoracic extension and help us identify other areas that are tight. I get the impression in Matthew's case that the latissimus muscles are restricting that a little bit. Just something we can go on to stretch as we move forward. Matthew, what I'm going to do is place this running kind of along your spine, and I just want you to lay back over it. So if you get yourself into position. At home, if you don't have one of these bolster cushions, you can get a nice thick bath towel, roll it up, and do the same sort of thing. Now, you should feel nice and comfortable and relaxed. You shouldn't be having to hold on with your neck to support your head. If you do, just place a pillow under there. And what I'd like you to do is just reach your arms back a little bit. So you're almost making that sort of Y from the YMCA dance position. And you should feel that there's a passive stretch kind of coming through your pecs. You should feel that your thoracic spine is kind of opening up a little bit. Excellent. So again, spend around 30 to 60 seconds in this position. Focus on nice deep breaths. And once you're done, we're going to just shift the position of this bolster slightly. So if I could just get you to sit up again, Matthew. If we talk about the thoracic spine or where our rib cage is, we typically have our primary curve or a kyphosis. What we're going to do here is just lie down against the bolster. So we're sort of starting around the apex of that curve. And you're just going to let your arms reach back behind you. It's fine to let your head drop back onto the ground. If that is uncomfortable on your neck, you can have a small pillow. Pressure to be applied to our mid-back. So what I'm going to have you do, again, Matthew, is just lay back, roughly going towards where the apex of that curve is. Now, what you can also do to start mobilizing almost in a more segmental. Next thing we're going to do is just use a towel tucked right up under our armpit. This is going to act as a kind of gapping device to cause our head of our upper arms just kind of come this way slightly. So what I'm going to ask you to do is either reach up just by your elbow, and you're just gently going to kind of pull your arm into your side, feeling like a little bit of a pulling effect here. So again, the goal of this is just to decompress in here a little bit, get a bit of movement. Movement is going to help with sort of fluid dynamics and circulation in that area. You can just gently hold that there for a few seconds, or just as you were doing before, just kind of pulse back and forwards. Good. Thank you. I'd like to get on to strengthening. We're starting by focusing on the rotator cuff, which is a series of 4 muscles that will come and attach right onto the head of the upper arm bone. And they play a very, very important role in kind of control of the position of the humeral head in the socket, or the upper arm in that shoulder socket as we move. What I'm going to have you do first is some external rotations with a resistance band. So if you just take a hold onto that free end, what you're going to do is keep your elbow tucked against your side, and you're going to just rotate your arm outwards. Good. And then you're just going to do around 15, possibly even 20 repetitions of here. We're going quite high repetition, focusing on the contraction of the rotator cuff, the external rotators. And towards the end of it, you should feel quite a burn. We're not adding too much resistance. Part of the reason we're going for higher weight is we don't want some of the other big, more dominant muscles to come and start doing the work that we want our rotator cuff doing. If you find that your elbow is starting to drift away from your side and come out, we want to limit that. Something that's very easy and simple to do is just try and hold a towel between your rib cage and your elbow. You'll find that if the towel drops, you know that your arm is drifting away, and then you can just make a bit more effort to keep it held close to your side as you do the exercise. So we now addressed external rotations. We want to address the other rotator cuff muscle, the subscapularis, which will deal with our internal rotation. So what I'm going to have you do is same sort of thing, except now the band is in this hand. Just take a little step towards me to put a bit of tension on that band, and you're simply just going to bring that band in and let it go back out. Of course, adding more tension to the band to make it harder as needed, or reducing tension to make it easier. As before, we're still going for that quite high rep range, so 15 to 20 repetitions, and resting around 30 seconds or so, 45 seconds between sets, doing around 3 working sets total. If you don't have a suitable point at home to anchor the band to, or you want to just be time efficient and work both sides at the same time, we can have you doing external rotations with both hands. So you're just going to keep your elbows tucked to your side as before, and you're going to pull the band apart and come back in, pull it apart, come back in, and repeat again for around 15 to 20 repetitions. So focusing on trying to improve our shoulder mobility a little bit further, we're going to use a towel to try and get into a bit of a sort of reach stretch behind our back. What I'm going to have you do is just hold the towel in one hand, let it go behind your back, and just reach around the free end with your other hand. If we turn slightly to the side so you can see what's happening. What I'm going to have you do here gently is just pulling down on the towel, trying to increase the range of motion you have here. Again, in that position, focus on some nice deep breaths. You can actually pull back on the towel the other way, just without actually letting it move, just to engage the muscles that we're trying to stretch with about 20% effort for around 6 to 7 seconds. Taking a nice deep breath in, and on the out breath, relaxing your resistance and just letting it sink slightly further into a stretch. So this is going to be biasing the anterior deltoid. I'm going to have you just bring your arm straight out. Good. And down. And again, we're going for something between 10 to 15 repetitions, depending on the resistance and what the goal is. If you want to increase the tension, because this seems a little bit easier, just take a step towards me or hold a bit further back on the band. Good. And bring it back down. And then in the interest of targeting more of the deltoids, what I'm going to get you to do is turn slightly to the side, switching arms. We're now doing a lateral raise. The previous one was a front raise. This is going to be working the lateral and posterior heads, as well as the front head to a degree of the deltoid muscles, as well as the supraspinatus. Okay, so for the next exercise, we've worked the front quite a lot. We also want to work the back. We're going to do something called a straight arm pull down. What I'd like you to do, Matthew, is take one side of the band in either arm. Arms straight, as the name of the exercise would imply. You're just going to use your latissimus muscles to bring your arms straight down. Good. You can even bring them back a little bit behind you if you're able to, having a nice intense contraction of the latissimus. Excellent. And then come back up. Good. I'm going to have you just kneel down. And I'm just going to have you try and sink forwards. And you should feel quite a nice deep stretch in through here. At this position, again, with his arms being fixated here, is promoting thoracic extension, or a flattening of the rounded posture of the thoracic spine. So again, in this position, nice deep breaths. You might find that when you take a deep breath in and fully exhale, you feel a change in sensation on that stretch. We can use the techniques we've been talking about a little bit here, where we try and actively push down into that windowsill with about 20% effort or so, contracting our latissimus muscles. And after around 6 seconds, nice deep breath in, breathe out and relax. Hang out there for a few seconds and repeat that process around 3 or 4 times in total.